Good morning, welcome to Breakfast with Louise Minchin and Dan Walker.
Our headlines for you today: just hours after Boris Johnson announced new coronavirus restrictions in England, it's revealed that government scientists warned tougher action 3 weeks ago.
Downing Street has defended its actions as robust and targeted, but England's chief medical officer warns that the new measures may not be enough.
I am not confident, and nor is anybody confident, that the Tier 3 proposals for the highest rates, if we did the absolute base case and nothing more, would be enough to get on top of it.
Well, let's talk about those continued changes. What's going on? With us now is the Director of the National Institute for Health Research, Professor Tom Solomon, to give us a view on the escalation of restrictions. And you are, of course, in Liverpool, which is now a very high Tier 3, different restrictions. What do you think of those restrictions? Do they go far enough?
I think we will ultimately have to have more restrictions. We were actually expecting worse really over the weekend, given all the rumours that there'd been. So the fact that we've still got our restaurants open is something positive, and pubs that are serving full meals. So I wouldn't be surprised if things do become tighter over the coming weeks and months.
Is it clear on what criteria that would happen?
I think the key thing is going to be numbers of patients in hospitals. We know the numbers are going up in the community, particularly among younger people. And then we've seen very clearly that that then spills over into older people and people at risk. And it's those then who mostly end up coming to hospital. And I think the critical thing will be, can the hospitals cope? And in Liverpool, things have got quite tight in the past couple of weeks, which is why we're at the Tier 3 level, as well as that high amount of circulating virus.
We've seen other places, regions with high levels as well, which are not in Tier 3. What do you make of that?
Well, I think, like I said, I think it's more than just the amount of virus that's circulating. It's the impact on the hospitals. And the plan is to be able to look after people with COVID and then also keep some of our other emergency services going, which didn't happen in the first lockdown. And so the only way that's really going to be possible is with use of the Nightingale Hospital. So I think that will be a big help.
And the Nightingales, are they ready to go? What are they being told?
I understand they're gearing up. I don't think they're admitting patients yet, but I think they will be in the coming days and weeks.
It's very interesting, isn't it, to see what SAGE was advising the government on the 21st of September, so some 3 weeks or so ago. They were also talking about test and trace, saying it was only having a marginal impact and would likely decline further unless the system expanded. What's your assessment of test and trace and whether it is helping?
Well, clearly, if test and trace was working really well, then we wouldn't need these kind of restrictions, because these are restrictions, they're sort of rather blanket restrictions, because you don't know who's infected, therefore you have to restrict what everybody can do. But if the test and trace system was working really well, then as soon as somebody came up positive, all the people around them would be isolated and it would stop the spread. So it's essentially not having as big an impact as we need it to.
I'm also looking at the other recommendations that SAGE did make. They talked, didn't they, and I'm sure you've seen it this morning, about a circuit breaker. And we did talk about that as well here on BBC Breakfast, and they described it as a short period of lockdown. Would that have made a difference? What's your assessment of that?
Yeah, I think that would make a difference. And what we're trying to do, what the government are trying to do, is to restrict measures without having a complete lockdown. But it's clear we saw from earlier in the year that if you do have a bigger lockdown, then you get control quicker. And the question really is what we want as a society and what decisions are made for us. What we've currently got is a measured restriction. It won't have as much impact, and therefore it will go on longer. And I would be very surprised if things have not ramped up a bit further by Christmas, unfortunately. An alternative approach would have been to say, let's have a sharp lockdown again for a short period of a few weeks, so that then things will be under control again by the time Christmas comes.
And there was a stark reminder yesterday from the Prime Minister, right at the beginning of that news conference, saying more people are being treated in hospital with COVID-19 than when we went into full lockdown.
Exactly. So, we always knew winter would be worse than the spring had been, and this is proving to be the case. But I think the difference is that we now have a much better understanding of who gets sick. Initially, in March and February, we didn't know who would get sick. It could have been young people. It turns out that it's old people and people with other illnesses get sick. And also now, don't forget, we have treatments that we didn't have at all. We're much better at treating patients with this disease now. So although the hospital numbers will go up, the deaths should not go up in the same same way as they did previously, because we do have treatments. So I think this is all about hospital capacity. And clearly what we don't want is lots of people in hospital corridors waiting for intensive care beds. That's not the kind of healthcare system that we want. And that's really what the restrictions are going to have to do, keep that under control.
On a sort of personal note, because we've talked to you here on BBC Breakfast for many months now, haven't we? I remember back in the day when you were here in the studio, and also I remember particularly one time when you were really feeling the pressure. Is it the same right now?
It's not the same as it was then. I think the pressure is building up, but the difference now is that we know what we're dealing with. We know the kind of problems the patients will have, and we know how to treat them. So the biggest pressure actually is for people who are managing hospitals, looking after hospitals, trying to work out how many COVID patients we're going to have, which wards are they going to go in, what's going to happen when they're full, what are we going to do with our routine care, our cancer care, our cardiac patients. So those are the guys who my heart really goes out to them, because they're really having to manage this situation on the ground. For the rest of us, it's just about looking after the patients in front of us, and the more patients there are, the busier we are, but at least we know what we're doing with them.
It's really interesting to talk to you again. Thank you so much, Professor Tom Solomon. Thank you.
You're welcome.